Bonjour à tous et à toutes. Good afternoon, everyone. Merci beaucoup d'être ici cet après-midi. J'ai derrière moi le plaisir d'être accompagné de mon amie et collègue, la députée de Brampton Sud, Sonia Sidhu, de la sénatrice Meji, Laura Siren, présidente et directrice générale de Diabète Canada, ainsi que de Monica Kosmaros, vice-présidente des relations extérieures à FRDJ, le Fonds de recherche pour le diabète juvénile, pour faire une annonce importante. Earlier today, our government tabled the framework for diabetes in Canada. This marks a very important milestone in the way Canada addresses a chronic disease that affects over 3 million Canadians. Supporting those living with diabetes has been and continues to be a priority for our government. In Budget 2021, we announced $10 million over 5 years for the Diabetes Challenge to help surface novel approaches for diabetes prevention and promote the development and testing of new interventions to reduce the risk associated with type 2 diabetes. Budget 2021 also announced $25 million over 5 years for type 1 and type 2 diabetes monitoring and prevention, and to work towards the development of a national framework for diabetes. We know that diabetes is a complex disease, and there is still significant work ahead to ensure better health outcomes for those affected, which is why we are here today. Comme vous vous en souviendrez, la loi portant sur la création d'un cadre national sur le diabète, présentée par la députée Sidhu, a été adoptée à l'unanimité par le Parlement en juin 2021. Depuis lors, nous avons travaillé avec de nombreux intervenants, y compris ceux qui sont ici aujourd'hui, pour favoriser un meilleur accès à la prévention et au traitement du diabète et assurer de meilleurs résultats pour la santé des Canadiens et des Canadiens. Aujourd'hui, nous sommes heureux de pouvoir partager les résultats de ces efforts. Le cadre sur le diabète a été élaboré en consultation avec des personnes vivant avec le diabète, des universitaires, des chercheurs, des organismes sans but lucratif, les provinces et les territoires, des communautés autochtones et beaucoup d'autres intervenants. Et nous sommes toutes et tous invités à utiliser cet outil important pour nous aider à comprendre et à lutter contre le diabète. The framework provides a common direction to help align efforts and to make a meaningful difference in the lives of all those living with diabetes. We also know that Indigenous peoples are diagnosed with diabetes at a younger age and tend to have more severe symptoms and to have more difficulty having access to appropriate healthcare services, and therefore face higher rates of complications and experience poor treatment outcomes. That is why an Indigenous-led engagement process is currently underway with Indigenous peoples, communities, and organizations, which will help identify priorities and address diabetes in First Nations, Inuit, and Métis populations. Before I turn to MP Sidhu, I want again to recognize her very, very hard work and for advocacy and success in championing this issue in the House, and congratulate Sonia for all the hard work she has done with many others to bring this framework to life. J'aimerais aussi remercier la sénatrice Meji pour tout le travail additionnel qu'elle a fait au Sénat pour arriver à l'unanimité du passage de cette loi importante et aux résultats que l'on constate aujourd'hui. Finally, I also want to thank dearly and very sincerely all of the individuals and organizations who have shared their knowledge and insights to help shape this work, including Diabetes Canada and JDRF, who are here with us today, and representatives of which will speak in a moment. I will therefore now turn it over to MP Sidhu. Thank you. Merci. Miigwech.
Thank you, Minister. Bonjour à toutes et à tous. Before we begin, I would like to acknowledge that we are gathered on the traditional and unceded territory of the Algonquin people. Welcome. My name is Sonia Sidhu, and I'm the Member of Parliament of Brampton South. In February 2020, I introduced Bill C-237, a bill that would create a much-needed national framework for diabetes. I'm happy to be here with you today as we mark this milestone and announce the tabling of this framework. This is a good day for the millions of Canadians who are living with diabetes or prediabetes. The national framework will enhance efforts and improve access to the best practices in diabetes prevention and care. Many Canadians with diabetes continue to face barriers and challenges. We hear their voices and we acknowledge them. The framework comes following tireless work and in-depth consultation process. I want to give my sincere thanks to all the experts and advocates that have been there with us on this issue from the day one. We know that chronic diseases are the leading causes of deaths in Canada, and this government recognizes the impact that diabetes has on the health of our residents. As a Brampton MP, I know every sixth Bramptonian is affected with the diabetes or prediabetes. 200,000 new cases of diabetes are diagnosed each year, when untreated, may lead to serious consequences. As the chair of All-Party Diabetes Caucus and through my nationwide consultation, I heard from the world-leading experts and attended international conferences where I heard clearly that a national framework is the best approach. This is why we are here today. I'm a strong believer in the importance of raising awareness. In 2019, I tabled motion M173, recognizing November as a Diabetes Awareness Month in Canada, but that is not enough. In February 2020, I introduced Bill C-237, seeking to establish this framework. I'm grateful to the Minister of Health and our government for recognizing that. I want to recognize Senator Marie-Françoise Maggi for co-sponsoring this bill in the Senate. I also want to thank Diabetes Canada and JDRF Canada for their tireless work and their advocacy. The framework means that Canada will have a coordinated response of diabetes that will improve health outcomes for everyone. It is focused around prevention, management, treatment and care, research, surveillance and data collection, learning and knowledge sharing, as well as access to diabetes devices, medicines, and support. This is about saving lives, and the Government of Canada will continue to work with the provinces and territories to improve health outcomes for all Canadians and Indigenous communities. The flame outside of Banting houses in London, Ontario is still burning. It reminds us we need to find a cure and extinguish that flame. Let's remember this. Canada gave insulin to the world, and with today's announcement, we are leading the way into the future generation. Thank you. Now I will turn the floor over to Laura Siren from Diabetes Canada. Thank you, Nick.
Thank you, Sonia, and merci to Minister Duclos. Good afternoon, everyone. It's a pleasure to be here among today's guests. And I'd like to begin by giving thanks. Thanks to you, Minister, and to the MP Sonia Sidhu, who's chair of the All-Party Diabetes Caucus, and to her parliamentary colleagues, whose commitment and leadership helped make this tabling today a reality. Sonia, I can genuinely say that without your tenacity and determination, we simply wouldn't be here today. People affected by diabetes could not have asked for a more inspiring or tireless champion. I'd also like to thank the officials at the Public Health Agency of Canada, many of whom we've had the pleasure of working with as a member of the Framework's advisory group. We're so grateful for your efforts to develop this framework and also for pushing it through, and on time no less, which is, I know, a feat in itself. Today's announcement marks a significant step towards improving the quality of life of those living with diabetes. And I stand here today both professionally and personally. Professionally, I'm the president and CEO of Diabetes Canada, but personally, I'm a person who lives with type 2 diabetes. So I can tell you with confidence that this framework has the potential to transform the lives of millions of people who live with diabetes, like me, and those who care for them. For the past 5 years, Diabetes Canada has proudly led the call for a diabetes framework, and we've done this in collaboration with more than 100 groups and individuals from across the country. So today's tabling of the framework for diabetes in Canada and the victory it represents belongs to countless people and volunteers from coast to coast to coast who never gave up on the idea of Canada having its own diabetes framework. And though the journey was long, we persisted knowing that this silent epidemic, which impacts more than 11.7 million people in Canada living with diabetes and prediabetes, and costs the healthcare system almost $50 million every day, was not slowing down. But we also persisted because we know some of the stories and the lived realities of those 11.7 million people. Stories of people having to choose between paying their electricity bill or paying for life-saving medications. Stories of sleepless nights as parents sat at their child's bedside to make sure their child with type 1 diabetes woke up the next morning. Stories of folks in remote communities not having access to affordable, healthy food to help manage or prevent their diabetes. Stories of people struggling with anxiety and depression because there's no end in sight yet for diabetes. Or my own story, which is all too common, of feeling scared and isolated and frankly ashamed when my doctor shared my diagnosis. These stories and the incredible advocates and members of the community, some of whom are with us today, are why we must seize this once-in-a-generation moment. Diabetes Canada looks forward to working alongside the Minister and our many partners and allies to fulfill the promise and potential of this framework. As we go forward, we at Diabetes Canada are committed to ensuring communities have access to the right resources, medications, and devices, to measuring progress and sharing better data, to improving education around the disease, and of course, to advancing research. As a proud Canadian and someone who lives with diabetes, the tabling of the framework today gives me hope. Hope that together we can show the world that Canada remains a leader in this disease and in the struggle to end diabetes. So thank you once again, Minister and Sonia, and know you can count on us to support this framework, but also on knocking with your door, soon with next steps in the coming weeks. And now it's my pleasure to welcome Monica Kosmaros, who's the Chief External Relations Officer at JDRF Canada, to share a few words. Monica.
Thank you, Laura. As a member of the advisory group for this framework, JDRF Canada is excited to be here on behalf of the type 1 diabetes community. Thank you to everyone who led this incredible effort from Diabetes Canada in your unwavering pursuit of getting the framework to where it is today, to MP Sidhu for introducing the private members bill. Your dedication to making this framework a reality is unparalleled. Thank you to Minister Duclos and the Government of Canada for your leadership in recognizing the tremendous need for this framework and for getting the right stakeholders in place to create it. JDRF is thrilled to see a clear path for improved health outcomes for the 300,000 Canadians living with type 1 diabetes. To put the burden of this disease into a bit more context, someone who has been living with type 1 diabetes for 52 years recently calculated how many insulin injections they have had to take just to stay alive, a staggering 100,000. To change these numbers, as the framework outlines, we need to continue building Canada's research momentum. We're seeing incredible results through clinical trials that are testing stem cell solutions that replace daily insulin injections. But we need to support the infrastructure and talent to launch these life-changing trials. The framework's holistic approach is also essential, as people living with type 1 diabetes are more likely to experience mental health challenges, like depression, and could benefit from interventions that prevent or treat mental health disorders. We are very grateful for the tabling of this framework and look forward to our continued journey in its implementation to ensure that those living with type 1 diabetes can live healthier, safer, and easier lives until cures are found. So thank you. I'll hand it over to Marie-France. Questions, please say who your question is directed to. One question, one follow-up. Les questions, dites qui votre question est adressée. Une question suivante. Merci.
Dave Baxter with Global News. This will be a question for either Minister Duclos or Ms. Sidhu. What can we expect to see the tabling of this framework?
It is table now.
Oh, now?
Yeah.
Yeah. All right.